All right, we go on to Wisconsin. And Donna Tompkins and Lucy Rowley are here on cooperative care. Thank you.
I am a caregiver. I became interested in caregiving when I observed my mother receiving care in her home some 15 years ago. I am also the president of the board of directors of a cooperative that has an operating budget of just under $850,000. But more importantly, I am a caregiver. There are 80 of us caregivers who are member owners of cooperative care in Waushara County, Wisconsin. On any given day, 50 to 60 of us will be in the homes of up to 100 clients who are elderly, developmentally disabled, or have some other disability that prevents them from caring for themselves independently. We get them up from bed, bathe them, make them meals, empty their commodes, mow their lawns, and change their beds. We do what they cannot do so that they can stay living in their homes safely. We do not work for an agency, we work for ourselves as member owners of cooperative care. We exist as an organization for two reasons. One, to give quality care to people who need our help, and two, to see that our member owners are better paid and for the first time have access to workers' compensation, health care, holiday and overtime pay, personal time off, training, scheduling backup, and support in problem solving. We are no longer alone, having to go to work sick because there is no backup, working for not much more than minimum wage, or unable to go to the doctor because there is no coverage for health care or work-related injury. We do not work for a corporation that manages our funds. At Cooperative Care, all the members are owners, and any net profit belongs to us. To run our business well, we are thoughtful and innovative. We reinforce our commitment to quality care with promises made to our clients that we will live by a set of values that assure them respect, honesty, dependability, and thoroughness. Above all, we are caregivers. We don't just give a bath, we build a relationship. We don't just toilet someone, we protect their dignity. We don't just do a job, we make sure they know we care about them as people. I am very proud to be just a caregiver among caregivers at Cooperative Care.
Caregivers are at the heart of the work that established Cooperative Care as a viable business entity. Most of us understand the need for caregiver assistance as we deal with aging or disabled family and friends. We understand the importance of maintaining independence and being able to stay at home. We understand that nursing homes or other institutions are the last place anyone wants to be, and yet in our long-term care system, it is only the institutional placement that is provided as an entitlement to so many of our elders. Care at home should also be a right, and we feel it is a public responsibility to make that happen. This being said, we also realize that the demand for home care workers is increasing while the supply is decreasing. One prediction is that by 2010, the demand will grow by 62% in comparison with a growth prediction of 15%. In Wisconsin, public services are administered by each of 72 counties under the long-held principle of home rule. Programs inadequately funded by state and federal sources, such as community-based long-term care, become a local challenge. Waiting lists and service restrictions are put in place. Service dollars are stretched as far as possible, usually by paying home care workers as little as possible. We were focused entirely on the consumer and their needs until it began to sink in that we must also focus on the home care provider. As a public agency, we have a responsibility to them and their families as they struggle to be self-sufficient. Without them, the objectives of community-based care would never be met, leaving institutional care as the only option when caregiving demands overwhelm family and friends. Cooperatives have been a part of rural life for well over 100 years, invented by people themselves to succeed financially. Cooperatives are well suited to the agrarian economy, but it is also easy to see from Donna's comments that they can be well suited to other economic endeavors. The Bronx-based Cooperative Home Care Associates saw that value with their development as a welfare reform project in the mid-1980s. We will always be grateful to them for providing the spark of the idea that ignited the reality of cooperative care. Cooperative care has in turn been able to provide sparks of its own that have now touched off project planning in many parts of the country, several of which will be made possible by federal funding through legislation sponsored by Senator Herb Kohl that provides replication funds through the agricultural budget, legislation grounded in the cooperative care experience. Thank you for the opportunity to be here today. We look forward to the future.
Thank you. Questions? Lee Shore.
If you wanted to see this model spread, in addition to the replication funds, and in addition to getting out information about what you've done, and I suppose you would also want to see the reimbursement system modified, but what else would have to happen so that other communities could do what you've done?
I'm the director of a county human services department, and I would think that what happened in our county would have to happen other places. And that is that we would have to move away from sort of a monocular view of the long-term care needs of the elderly and see that we have a binocular view of the community as a whole, and that if we don't also have a commitment to those caregivers, then the goal is not going to be achieved. That is not a commonly held view across the County Human Services Department in Wisconsin. So I would have to assume that that's probably not true other places as well. So that value would have to shift. Because without that, the other issues that you mentioned are not going to be successful either.
Other questions here?
If I can just make a comment, there's an analog there in the child care field.
Yes.
Where also the issue of people being able to afford child care, but the child care providers being able to be compensated,
yes,
respected, et cetera, is also a big
Yes,
problem.
that is correct.
Susan Schwab.
One of the issues that comes up when you're having a conversation about cooperatives is the sustainability of co-ops. There's an uneven history, and if you could talk about some of the challenges that you've faced and the sustainability of this model.
Initially, as we were doing our research and trying to find other similar cooperatives, with the exception of the one in the Bronx, which we feel is entirely different, including one here in Boston, they said, don't do it. Absolutely don't do it. You're wasting your time. It will never succeed. The reimbursement rates are so low that it's not going to be possible. Well, never say don't to some of us. I think that by building on a business model that is successful, at least in our rural communities, that sustainability is perhaps more attainable than in other areas where they're starting basically from scratch. We started with a community of people who were already providing care. It's just that they were being poorly paid and had no benefits. So by tapping into that particular source of labor, we were also tapping into the programs that funded the activities that these people carried out statewide. So at least in terms of Wisconsin, because of the way their long-term care system is organized and the way that at least they're projecting into the next 5 years, we feel that it will be sustainable by primarily the use of the public money that's available.
And to follow that up, this is an inspiring program. The question arises, I think, in people's minds, is this something, because it's in Wisconsin and because it's rural Wisconsin, has a special place in that part of the country, or do you think you could see this growing up in much more urbanized settings?
I think it's been studied that, we worked with cooperative development specialists, and all states throughout the United States have, USDA offices, and they have cooperative development specialists. And we've been, our program has been cited nationally through the USDA as replicable in many other parts of the country and also worldwide.
At USDA, at cooperatives, that does raise the question about the innovative quality, how innovative it is, and that's what I also was curious about.
Okay.
How can you address? I mean, there are a lot of cooperatives of various kinds.
Correct.
Is this innovative because it's one of the first of its kind or pioneer in home care for the elderly? What is that? What we're talking about here?
That is one. In our experience with the people from USDA whose business is developing cooperatives, they have never dealt with one that dealt with basically human services, and particularly in providing long-term care. So that is in fact unique. I think there are some other unique organizational features to this co-op, which we don't have necessarily time to go into, that are perhaps different from, let's say, an agricultural products, or even in Wisconsin, a cab company in Madison.
Fine. Kathleen.
Time is up. This is, you're having to run a business now, so maybe that wasn't the experience of many people who were caregivers, and I was wondering if their understanding of business practices has changed, increased in any way.
Well, we're caregivers. Basically, there's 80 of us caregivers. There's
Right.
not too many of us had a lot of business experience, so we've had to rely on a lot of outside help with the USDA, with government agencies, and through the Center for Co-ops. And we are a 5-member board of directors. We have been involved in director training, which is ongoing, which could all be replicated or throughout the country. And we're learning about business. I have brothers who are business people, and when they heard what I was in, because they knew I was a homemaker and a mother and a grandmother, and I was doing care in homes, and they were really questionable what I was getting into as a business. And so now they ask me, well, what are you doing? Tell me about your business. So I guess we've learned a lot.
Mrs. Tompkins, may I just say that we often celebrate here, as we do today, 2 young people who come. It is a rare and special treat to celebrate a woman who has 7 children and 11 grandchildren. Thank you.